National Nurses Week coverage continues. Actually, today is Nurses Day because it's Florence Nightingale's birthday. We talked about that earlier this morning. Our local nurses have worked tirelessly during the pandemic to help our community fight past COVID-19. They've been doing life-saving work now for a long time.
Oh my goodness, we've been thinking about them. This morning, Anchor Ray Daniel is live from Olathe Medical Center with their Chief Nursing Officer. Good morning, Ray.
Good morning, Lindsay. That's correct. The Chief Nursing Officer, Chris Courtney, is with me now. And Chris, I just want to dive into this conversation. You know, tell us a little bit about the need, from what you all needed from the beginning of the pandemic to where we are right now.
So I think there's still a need. It changes. We went from having a need for whether it's personal protective equipment, nurses to take care of COVID patients, and now we're moving into the need of nurses once again to take care of patients as they vaccinate the population. So at the height of the pandemic, we had a COVID unit. I think the great thing about that, when we think about nursing, we had volunteer nurses to take care of those patients on a daily basis, far more than we needed. They jumped in without any hesitation to take care of their community.
So you actually had this as a volunteer saying, hey, who can help with this unit? Talk a little bit about that.
Yeah, so we asked nurses. We didn't think it was fair to put them in a situation where they had to make a choice. So we asked anybody who'd be willing to care for these patients on a COVID unit to come forward, and like I said, we had more than we needed. They were all ready, willing, and able to volunteer. So it was really very enlightening for us.
And something that was mentioned earlier is that they were wearing that protective PPE all day, throughout the day?
Yeah, so caring for these patients takes a little bit more, the personal protective equipment necessary to take care of these patients, to keep them safe and others safe, created an environment that was a little more difficult than they would usually work in. So the fact that they volunteered for that and knew that going into it was heartening for all of us to see.
Chris, something we talked about earlier is, you know, tired yet resilient. Yeah. Is it, I guess, a breath of fresh air knowing that we are seeing more and more people get vaccinated? What are you seeing from these nurses?
Yeah, so, you know, when the vaccine was first announced and that we would be getting it, we couldn't wait to get it. All of our nurses stepped forward to receive the vaccination. A very emotional moment for them, right? They had spent a great deal of time taking care of these patients. They had seen what was happening to these patients as they contracted COVID and had to recover for that. Many were months in the hospital recovering from COVID. So for them, that vaccine was really kind of that glimmer of light at the end of that tunnel. So they're exhausted, they're tired, but once again, they're stepping up to help vaccinate the community.
That's amazing. Chris, thank you so much for talking with me. I really do appreciate it. Awesome. Well, you heard it. Our nurses, tired, exhausted, but resilient and caring so much for these patients for the past 14 months. Taylor, Lindsay, back to you.
I mean, you can hear the happiness in her voice and the dedication, all these things that they've been through for the past year, and to still be able to have that kind of attitude moving forward is really something.
We are all so incredibly grateful to all of our nurses. Ray, thank you very much.